right, today I'm going to do an assessment of your head, neck, and your lymph nodes. So I'm going to start by palpating and inspecting your skull, okay? You have normal cephalic size. The contour is normal and symmetrical. Alrighty, we're going to feel your TMJ is what it's called. So I'm going to put my fingers on your jaw. Can you open your mouth for me and close? Good job. No clicking noted, no sticking. Do you feel any pain with that or any tension? Alrighty, and I'm going to feel it for the temporal arteries. Alright, noted. Rate and rhythm are normal. Noted here also normal. Good. Alright, so I'm going to have you do some facial expressions for me to test the symmetry and make sure your nerves are working right. So can you raise your eyebrows for me? Good job. Both eyebrows raised symmetrically. Close your eyes super tight for me. Also symmetric and open. Good job. Can you give me a smile? Lips on both sides symmetrically and frown. Big frown. Big frown. There you go. Good job. Alright, now we're looking at the nose. It is symmetrical. No deviation of the septum. I'm going to check for patency now, so I'm going to close down one side of your nostril and have you breathe in deep, okay? Go. Good job. And other side, go. Good job. Lips are pink and moist. All right, open your mouth for me. Good job. The buccal mucosa is also pink and moist. Can you smile? Give me a big smile. There you go. Teeth are healthy and adhere to the gums. Give me a there you go. Perfect. And look at your tonsils. Tonsils are also normal, about a 2+. All right. And I'm going to feel your sinuses, okay? So we're going to feel up here. Do you feel any pain or pressure?
No.
Perfect. How about through here? Any pain or pressure?
No.
Awesome. All right, so now I'm going to go ahead and feel your neck, okay? Got your muscles. Feel good. Symmetrical. Sternomastoid. Trapezius muscles are also symmetrical. Okay, let's see. Our trachea is in line. No deviation to one side. I'm going to go behind you now and we're going to do a swallow test. So I'm going to put my hands on your neck and you're going to do one big swallow for me, okay? Alright, and go. Good job. Thyroid gland is freely movable with the swallow. Palpation is normal, no nodules indicating any problems with the thyroid gland. So now we're going to go ahead and I'm going to feel your lymph nodes. Okay, so a couple different spots. I'm just going to palpate real gently to see if I can feel your lymph nodes, okay? So we're going to start with the pre-auricular lymph nodes in front of the ear. Move to the post-auricular, occipital, the base of the skull, the jugulo-digastric, which is going to be at the angle of the jaw. Submandibular, halfway between the tip and angle of the jaw. Wounds are slightly noted, but they are discrete and movable, so that means there's no problem there, no concern. Submental under the tip of the jaw. Also discrete and movable, but noted. Alrighty, so now I'm going to feel the superficial cervical on top of that sternomastoid. Noted. The deep cervical we can't palpate because it is deep to that muscle. And then we've got the posterior cervical and the posterior triangle of the neck. Not noted. And then supraclavicle, which is behind below the clavicle, also not noted. Alrighty, so your lymph nodes seem good. None of them are hard or fixed, which is good. That means there's no sign of malignancy or cancers. So now last thing we're going to do is I'm going to have you test some range of motion on your neck so we can make sure your neck muscles are working all great. So I'm going to put my hand here, push against my hand. Try to turn your head that way and look. There you go. Good job. And the other side. Good job. And sit up straight for me. And try to shrug your shoulders. Good job. Range of motion is normal, which means cranial nerve number 11 is working. The facial expressions are normal, which also means that cranial nerve 7 is working as well.